Hi, it's Leah Briick. We're here for another Conversations from the Couch. I'm really privileged today to be sitting with Captain Lindsey Hancock and Lauren Rich. And we're talking about sexual health issues in the military. And this is a topic, well, the military is a topic that's near and dear to my heart. I have a son that's in the Navy. I have a son-in-law that was in the Army. My dad was in the Navy. We just got a lot of military in our family, and it's just, I'm a patriot, and I just love doing things and for our military. So thank you both for joining me today to talk about this.
Happy to be here.
Yes, thanks for having me.
Yeah, absolutely. So when we started this conversation about getting together and having a little coffee chat about the sexual health in the military, it's probably not one of those things that most people think about, that there's sexual health problems in the military. And so, let's talk about what kind of potential problems might exist with the military when it comes to sexual health.
Lindsay, I'll let you kick that off since you're still active duty.
Okay, sure. Well, I think one of the things to address as to first of all why there really is even some sexual health issues in the military, especially our active duty population, is um, trauma, combat trauma, military sexual trauma, job related stressors, just the everyday op tempo, the go 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 method of working in the military, and then frequent absences, so being gone for long periods of time. And I think overall umbrella terms, intimacy is a huge struggle in the military with our population.
Yes, yes, absolutely. I think job related stressors might actually come in number one, even above trauma. Not that percentage wise, the entire military is not deploying all the time. It's a much smaller percentage. So when you think about the things that actually impact people on a daily basis, I think it's much closer to the job related stressors. For those who are stateside, when people deploy, it comes out looking different. It may be prostitution or a port in particular, or even fraternizing with other countries, military members, or even our own military members. But for those who are stateside, boy, the stressors of being in the payroll office or admin, you couldn't pay me all the money in the world to be a military PR person. job that job has most certainly stressed people out. I know a few of them. They've been in my office before. And so I think the everyday stressors of work in the military is probably one of the biggest hurdles for people that leads them to problematic sexual behaviors.
Yes, I would agree with that, Lauren.
Yeah.
The A lot of the life is just unpredictable. You really don't know what to expect from one day to the next. Your day looks quite different, especially in garrison, when
Mhm.
not deployed. A lot of folks that I see prefer to be deployed in some sense of the word, because they at least have a little bit more idea of what to expect, or maybe a little bit more autonomy in what they're doing. So sure,
Mhm.
the job related stressors are a huge factor in what definitely I deal with, in terms
Mhm.
of
I
well.
think that's a great point. I see majority combat veterans, some still active duty, but the discussion of it's so much easier to be deployed, that is really pretty black and white. Either I live or I die, and that is the main focus for today. We don't have to worry about wives or tending to emotional needs or being emotionally available for children when we're in the sandbox. But then we come home, and those are the expectations. And then we're also faced with finding our role again post deployment because, well, the world has continued to spin even when they are gone. And so I completely agree with Lindsay. I think life is so much easier on deployment that people don't quite know what to do when they return.
Right, it's
But
just almost more stripped down. Yes.
well, and you
Mhm.
mentioned intimacy earlier, Lindsay, and I think about that intimacy. You're talking about kids, you're talking about partners, and I may be in a classified job where I've got a lot of information that can't be shared. And so, how am I going to have intimacy with my family when I can't talk about my job? or even just being on the job and those stressors of the unpredictability of the military. One day I'm getting ready for deployment. I mean, I experienced this with my son-in-law, where he was waiting months, knew he was leaving for deployment, but then it was on off, and my son has experienced the same thing in the Navy. And so how do you maintain that relationship with your loved one when things are so unpredictable?
Exactly. And it's not just deployment, right? So we have TDYs. Folks might go on a 3-week training exercise in another state, and even still might not be able to tell much to their spouse or loved ones about their training or about their deployment, maybe even where they're going. And that creates just such emotional distance. And then coupled with maybe that service member experienced some trauma downrange or in a training environment, and they are not ready to talk about it, or they don't feel like they can talk about it for security reasons. And that just really interrupts the intimacy of a relationship, even with children.
I would agree. And to second that, I think TDYs are killer for relationships. I remember working at the FBI as an intern in the Employee Assistance Unit. And when you TDY for 90 days at a time, 6 months or six TDYs out of 18 months or whatever, make up whatever number you want. It's a continual wedge, if you will, that if allowed can grow and grow with each TDY. And sometimes people leave on those and they realize that maybe I don't know my spouse as well as I did, or do I want to be in this marriage? And the stress of that, seems to get worse and worse the more they are gone. On the flip side of that, when you think about the success of marriages in military life, I think some of them have been successful in marriage only because of their absence and deployment. I think they would have gotten divorced years earlier had both parties been at home every single day. It would have never lasted. So I definitely think there's two sides to that coin for sure.
Of course, I don't think it's all negative at all. I know several marriages that have benefited from having these breaks from each other and then reconnecting after a deployment or a TDY. Certainly, communication would have to be pretty strong in a relationship if you're relying on things like FaceTime and texting and emails, especially to deal with the daily chores of the household. So then, unfortunately, on the negative end would maybe breed things like infidelity if the spouse is already feeling disconnected from their partner and then they're also physically absent. That temptation might be a little bit more prevalent, or maybe the person feels like it's easier to get away with something like that.
Yeah. That's going to happen on both sides, though, right? That's just not on the service member that's being unfaithful. That can happen to the partner sitting at home waiting for their loved one to come back.
Right. Yeah. A lot. I see active duty folks, and a lot of them struggle with concerns of, hey, what is my spouse doing when I'm deployed or away? And it's kind of hard to see and offer that reassurance when it is sometimes a common thing, even in civilian population.
That is most certainly the time when people have to be told, do not speculate. Don't let your mind wander to those paranoid places. You have to base your decisions off of hard evidence. And I tell them repeatedly, feelings are not evidence. Your feelings of them having an affair or being unfaithful is not evidence. Where is the evidence to support the theory that they have been unfaithful or any of those types of things? I completely agree with that piece. When you think about the easy stuff of deploying in that sense, gosh, marriages are so complicated in the military, but I have to encourage many people to think about it. When you got married, what was your expectation? Because I too have seen those military magazines and their military weddings on the cover, and we have uniforms and bridesmaids dresses, and boy, is it romanticized. And then people get a dose of reality and what it is really like. So I think sometimes just, reality check for people is, are your expectations realistic for where you are in marriage?
All right, why don't we talk a minute about how people end up in services? So, Lindsey, you're in active duty, and my perception is that somebody who's having struggles with sexual health issues, well, first of all, I would assume that they don't even think they should be talking about that. That's not something that it's not a topic that we have regularly. If you do, whether you're in the service or you're not, we just don't talk about that in our world very often. So that's one thing I think of. The other is, if I go into counseling, then what happens with my job? And so can you speak to that a little bit? What is that? What is that? What is that like? How do you get them in?
I can honestly say, sex is never the presenting problem. It is always something else that walks in the door, and somehow sex sneaks in there, maybe session 4, 10, whatever. I've even had referrals from colleagues before when I worked at the VA that he was seeing this provider for combat trauma. She was on my team. He just happened to be assigned to her. And in maybe the 4th or 5th session, he disclosed that he has an issue with sex shops or pornography or whatever. And she says, "Oh, can't help you, out of my scope." And so, sometimes clinicians have to refer out, but it is hardly ever the actual presenting problem that people walk in with. It is always something else that they're showing up to talk about.
Right. I think you have so many layers to break through with that therapeutic relationship and that building that trust. Because first of all, to get them in the door, it's often feels sort of humiliating, or they're going to lose their career or their security clearance, or I can't get this job in the future if I get this certain diagnosis. And those concerns are pretty real, because certainly that has happened before in certain circumstances. And then you have the issue of talking about sex just in general, which is uncomfortable for a lot of folks. And I agree with Lauren. I often have to prompt, like, hey, how are like your relationship with your wife sexually, and or your husband or something, or because they might come in saying, hey, I really can't sleep. That's really my only issue. And then we open it up a little bit more from there. And then from there, just being able to develop that trust to work on those issues is pretty difficult, because we have to break down a lot of that stigma with behavioral health, especially in the military.
It's such a unique population, because it's going to have its own nuances, and you as clinicians have to understand that population and how different their issues are. They're going to be very different than like a me walking into a therapist's office.
If you're a member, yes, if you're a military member listening, you need to be very upfront and honest with your provider. This is the diagnosis I'm concerned about. I'm not saying, that you get to dictate treatment and diagnosis as the patient, but in clinical world, there's probably about 20 different diagnoses that we could choose from that would still be appropriate for most people. And so if you have one that you're concerned about, PTSD, for example, we may be able to classify it or meet criteria for something else like anxiety or neuroses or adjustment disorder. Any one of those would still be appropriate and help you protect your job and maybe make you feel more secure in the long run.
Yeah, I think that's an excellent point in advocating for yourself as the client, someone who has a lot of rights in this situation. Hey, what maybe of this conversation are you going to be speaking to my commander about? Who will find out in terms of documentation down the line if I want to become a recruiter or a drill sergeant? Because those notes and those conversations are okay for you to ask about and ask for physically.
Yes, absolutely. Especially if you want to grow and be an NCO or warrant officer of anything, and you're going to have authority over people, then yes, I as command would want to make sure that you're appropriate to have authority over people, because we don't want anyone below you being exploited. And so I agree with Lindsey. I think you have a lot more power as a client than what people realize. It's just learning to exercise those rights and to execute them appropriately. When you think about the clearance piece of it, I have a number of people who have had that issue, and I've held a clearance before. I get it. I wouldn't want to see anybody either, but ultimately they will review your clearance paperwork anyway. So you need to be the one to disclose that you're seeing somebody, what you're working about, and you need to be the one to discuss with your provider in advance. This is what's going to be expected of you, that you'll have to fill out the SF-86. These are my concerns. How can we answer the questions honestly without violating confidentiality? And if you have a provider who's worth anything, they should be able to do that for you without any problems.
That whole stigma around asking for help, I gotta believe that in a system like the military, that is just so prevalent. How do you get somebody past that? Because I mean, we have that stigma anyway in our society. We're not going to go ask for help. It's getting lesser as time goes on. You know, things, there are certain diagnoses that are more acceptable, but in a military system, man, I just can't imagine that that's something that's easy for you all to deal with.
It is hard. A lot of, we wear our resumes on our uniforms. A lot of time we're very um, fearful of being judged, I think, or compared to peers and rated against other peers that aren't, that are outperforming us, not feeling like we're not good enough. I can certainly identify with that. Um, so not having anything against you is really helpful. Um, Feeling like you always have to have everything together, that you have to be, that strong appearance, masculine kind of soldier is hard to live up to, especially when you're struggling with things like depression, anxiety, trauma, relationship issues, sleep issues. So what we like to do, I have the ability to see patients about half the week, and then also go do outreach and prevention within my brigade. Um, and so them seeing us on a regular basis, kind of normal conversations, don't always have to be talking about behavioral health, um, just kind of treating everybody like normal people, helps with that stigma, I think, a little bit, where they can reach out and say, hey doc, uh, I need to talk to you about something, and it can be walk over to the side, and they have that access to us. Um, so I think with the prevention piece and getting out there to the different units is helping. Having senior leaders say, oh yeah, I have been to behavioral health myself, and my career is just fine, and actually it benefited me a lot. Those type of mentors, influences helps reduce the stigma. But I think we still have quite a way to go.
I would agree. And you ultimately have to ask yourself as the client or service member coming forward, what am I risking by not getting help? Am I risking my career by refusing to go see somebody? Because that happens a lot. I can tell you one of the reasons I like working with men the most, my whole practice is targeted and devoted toward male combat veterans. And that is because 9 times out of 10, by the time they are calling me, they are ready and committed to do the work. Unfortunately, most of the time, because life is already so bad, they have waited way too long to get help. But you really have to think about, what do I risk losing? Do I risk losing rank? What happens if I get a DUI? Then what's going to happen to me? If I get chaptered out, what is that going to do to my retirement? What will it do to my kids and their tuition? So a lot of times I think for people to fight stigma, they really have to just make that pro-con list themselves of, what do I risk losing by not going to get help?
Right. What do I have to gain from this?
Mm-hmm.
And it typically is a lot. If what I tell people certainly is, if you're not developing that therapeutic relationship with your therapist, if they say things you don't like, if they don't really listen to you, understand you, you can always request someone else. It's very possible to find someone that works well with you, and it is hard to find those good therapists that you can work well with. So definitely advocating for yourself to make your life better.
I would agree. And This whole I have to see somebody on base business, what an excuse for service members. That is not an excuse, especially at large metropolitan areas that have lots of providers. If you are displeased or unhappy or feel that you can't trust those people on base, I'm not saying Lindsey's fabulous, but it is not an excuse to not get help. There is plenty of opportunity out there for you to fix what is going on. Base, quote unquote, is not an excuse to not get help.
Sure. Something that I speak with my folks about is Military One Source as a great resource for active duty and retired folks who really are concerned about, hey, what's going in my documentation? I don't know if I want all this written down, and it might get told to my commander or something like that. And so they offer free counseling, and especially in these COVID times, Zoom is available. So if they live in a different state, or if they're OCONUS on a deployment, or their duty station is in somewhere like Korea, they can work with someone in the United States via Zoom. And it's a civilian provider that has no connection with command at all. And there's plenty of ways to address those issues. You get various sessions for free for every issue that you bring forth. So that's a great way to, if you're concerned about confidentiality or privacy, a great free way to at least get in the door to kind of see, hey, what's this therapy thing all about?
And people also have to understand that there are laws that help them see exactly what's going on their chart. The open notes mandate that came out last year, you are by law entitled to see your records all of the time. And I actually think that law stated that it had to be available to the client in an electronic manner that they could access. And so if you're concerned or you're still mistrustful of your provider, whatever that may be, go look and see what they're writing. Go look for yourself and see exactly what is going in your chart, and then you can make a decision from there. But I'm pretty sure that's federal mandate across the board now for everyone who provides services.
I want to bring us back to something we were talking about earlier, and that's intimacy and certainly sexual health. That's where we started. Like, how do people end up in your offices talking about sexual health? And I think it's really important to mention that in order for somebody to be going to see a therapist, we need to make sure that those therapists, you've got to be asking the question, like, how are they trained? Because not everyone, both of you have training in sexual health issues, but not everyone understands problematic sexual behavior. And that's a really important differentiation between just a regular counselor, a counselor who has basic counseling background, and somebody who's dealing with perhaps sex addiction. We really need to make sure that they're seeing somebody that has that information, understands it.
I always tell people SASH.net, you can look online and look at the provider directory, or sexhelp.com has a provider directory as well. But you would never see a cardiologist for cancer treatment. It's a specialty like any other. So you need to make sure that you find the right type of specialist, because we don't want to be treating the wrong problem for years and years and not have benefit.
And I think that's great. And even if you're going to therapy within your unit or on post or something, ask, is there anyone that you know that you can refer me to on post that specializes in these things? Because I really would like to address this specifically. Because you don't want to open everything up and feel comfortable with your therapist and then find out, hey, they're actually not going to be able to address this problem that I'd like to address.
That's how we met, right, Lindsey?
Yeah.
We met because some of our SASH members came and did a training for you at your unit where you were at. We came and gave some specific training for problematic sexual behavior. And here we are today, where you have a lot of knowledge about it.
Exactly right. Yeah. And for therapists too, I mean, if that's something that you're interested in getting trained in, reach out to the folks that offer those trainings and have a better, I guess, be able to have a better repertoire. Hey, this is what I can offer to my clients.
it's not good enough for a therapist to say, stop doing that. That's not, that's not going to cut it in sex addiction world. It's so much more complicated. And I think the comical part is people really don't understand, and a lot of therapists don't understand, that sex is never really about sex. Sex is always about meeting a greater emotional need. And so when you start to educate clients on what that process looks like and what are we really trying to meet with these behaviors, then you can actually get somewhere. But again, takes a specialist to understand and know that process.
I want to thank both of you for spending some time with me today and, doing a mini deep dive into sexual health in the military. There's a lot of food for thought here, and just appreciate both of you in taking care of our service members and spending time with me today.
I appreciate the opportunity, Leah. Lauren, it was great speaking with you as well. To the service members, thank you for all you do for the people who support them, civilian and otherwise. Thank you so much. We could not go forward without you. So thank you.
Agreed. I hope we get to do another one.
Thank you.